Hi everyone, it's time to talk colon cancer. My name is Dr. Laryea and I am one of the liver specialists here at University of Rochester Medical Center. And today I thought I would talk to you about some of the conditions that are associated with colon cancer in patients who have underlying liver disease. So people who have a condition in their liver that might be putting them at risk for colon cancer. So the first one is a very common condition called fatty liver disease. And you may very well know someone who has fatty liver disease or suffer from it yourself. About 1 in 3 Americans have this condition, so it's very common. And the science seems to show that people who have fatty liver disease are at increased risk of having polyps that can lead to cancer and actual colon cancer. And in men, the risk is about twice as high as people who don't have fatty liver disease. So if you do have fatty liver disease, there's somebody in your family with this condition, you want to make sure that they're following the guidelines and getting screened for colon cancer. Another liver condition that's associated with colon cancer is much rarer, and it's called primary sclerosing cholangitis, or PSC. It's a disease of the bile ducts that's often seen in people who have inflammatory bowel disease like Crohn's disease or ulcerative colitis, mostly ulcerative colitis. And in those patients, there's a very significant increased risk of cancer. So if you may already know, if you suffer from these conditions, that patients who have inflammatory bowel disease are at increased risk of colon cancer. Well, if you take the risk of those patients and you add on PSC, that liver disease, the risk goes up 4 times as high. So that's multiplying it 4 times. So it makes a very significant risk that's already there even higher. So definitely, if you have primary sclerosing cholangitis and you have inflammatory bowel disease of the colon, you're going to want to have your colonoscopy done once a year from the time you're diagnosed with your liver disease. So fatty liver disease, very common, associated with a 2-fold increased risk of colon cancer in men and an increased risk of polyps in women. And primary sclerosing cholangitis associated with a 4-fold increase in risk of colon cancer over the risk of your inflammatory bowel disease. So if you have liver disease, colon cancer is something you need to worry about. But thankfully, we have great preventative tools, including colonoscopies and other tools. So you want to talk to your family doctor about getting tested and screened.